Thank you so much for agreeing to sit down with us. My name is Jacob Crawford. I'm working with SECCA 2021 and sitting here with Dr. John Burkhardt, who is the Assistant Medical Director, Family Medicine Residency at the University of Alabama. Did I say that right?
Close up, assistant residency
Okay.
director. Family
Aha.
medicine.
Okay. And we wanted to get together and have a conversation about um, burnout in the workplace. The last 12 months, I guess, to kind of put it lightly, have been a bit of a transition period. It's a bit of a change period. And one of the things that has been kind of plaguing our office is a sort of feeling of burnout, a sort of feeling of kind of lack of place, and kind of how do we navigate this kind of new world that we found ourselves in. And so, we would love to sit down and kind of itch your brain on, the various aspects of employee burnout, not just here at the University of Alabama, but in general for higher education and higher education communicators. So not necessarily people who are student facing, but people who are kind of working the office marketing jobs, and communicating with our various branches and our various universities in the Southeastern Conference.
Sure. So, well, first of all, thanks for having me. It's a pleasure to get to meet you and be able to talk about this. You're right. I mean, obviously, we know with the pandemic, it's caused a lot of stress. We've heard a lot about it not only in the news, but people are starting to write about it more. And we've seen different short and long term effects of it, which I'll kind of cover a little bit today. I have some slides kind of talking about stress in America because I think to answer the bigger question of stress in the workplace, we kind of have to think, our workplace is an environment, right? But we just don't live at work. We live at home and everything else. And so we're really talking about stress in our biggest environment, which is almost like our world, or especially for the United States. We haven't seen anything this long term in quite some time. So it has a little bit, different effects on different people, even though some of it is very similar. So I figured, we could walk through and maybe, I think there's some pretty big buzzwords now, like what is wellness or well-being, what is burnout, especially in the medical profession. That comes up quite a bit, which is where I work the most. Stress comes up too, but stress comes up for everybody. And what I thought would be kind of nice is some of the information I have is really from the area I work in, which is graduate medical education. But at the same time, if you replace the word with physician with marketing director, or marketing personnel, or um, I don't know, receptionists, telephone pole person, garbage, um, waste management. Excuse me, that's the term I was looking for. It's all the same thing, right? When we're just talking about a human being. So I figured we could kind of go over that maybe at the very end. I have a bunch of different tips that can kind of help people, and it's kind of related to some of the things I've been kind of hearing with the pandemic. So we kind of have a little fun walkthrough today. So if we really look at the slide after this next one, and what I did was I went with the big term definitions first, or what I kind of think of what it is, so everybody has a reference point, right? So the things that we kind of teach our residents here at the university is, physicians have a high exposure rate for burnout and depression, but well-being isn't just one thing; it's a lot of things. So you talk about the psychological, emotional, and physical pieces of it, which really help make one resilient, but also what I think everybody really wants in their job is they want to be able to take some joy in their work, right? And the other thing that we're kind of looking at and teaching, our residents and just even the folks here that work within our college is it's not your well-being just isn't your well-being. You'd like it to be this almost as this culture of shared responsibility. So even at times like this with the pandemic, we're kind of helping each other and assisting everybody because, as you know, some people have better days than others, so they need that lift and they need that support. And trying to find where wellness or well-being kind of fits in can be challenging for some folks. And if you go and you look at, the next slide, we look at our favorite thing, which is symptoms of burnout, right? This is kind of a term. I don't know, Jacob, have you seen some of these before?
One or two, yes.
Any ones? Which ones have you seen?
Personally and myself, or in just kind of the
Just in
surrounding
general,
around.
like maybe what you kind of hear.
Hmm. Oh, I know in my own work, I do feel a lot of like, there is a lot of decreased satisfaction and sense of accomplishment, especially, as we've been distributing communications, especially towards the end of COVID-19, as like these, kind of restrictions start to lessen up. And, you know, um, that's definitely something I felt decreased motivation, especially as people have been moving back into the office. People kind of, we're all creatures of habit, and the feeling of we've adjusted to this new kind of habit or structure for ourselves, and having to move back into the previous structure that we've had here at UA. We've been moving back into the office. um, I've noticed has led to a lot of decreased motivation, at least on my end.
Hmm.
Would you say that that's consistent with the people that you talk to and see?
Yes, I would, and I think they don't really describe it as decreased motivation. It's almost like I kind of think of it as, I grew up in the north, so it's almost like getting stuck in the snow or maybe stuck in the mud, right? It's the slowness. It's kind of hard getting things done. It's um, brain can almost sometimes feel like a little foggy, which we kind of hear about when we talk about COVID. There's an article, I think, written by a psychiatrist that I happened to read that was talking about that, and their first concern was maybe they were getting COVID, but it really wasn't that. It was more talking about the effects of the pandemic, and so we see that. And again, I agree with you. As you start to shift back, it's you sit there and say to yourself, "Well, I just got used to working from home and zooming and not being worn out, and now here I am back again." And while it can be good, right? So you take a company like Apple, who says we still want you coming to work for many reasons, but one of them is getting people together and talking, besides trade secrets and things like that. Um, but they also recognized, well, we can't have some people, even if we let everybody work remotely, some people can't come on some days and other people come in on others. We like to get everybody together on the same days. So they looked at a model where, you know, I think it's like 3 days a week, whatever those days are, everybody's there. So you can communicate and, get projects and things like that done. And if you think about it, um, you start to miss your coworkers, right? You start to miss other things. And it's also a good change in the environment, your environment, going to work, coming home, you start to appreciate different things. So, yeah, I mean, I have seen that, I guess, in answer to the big question. The next slide really kind of goes to what you kind of talked about with us before, which everybody really wants to talk about is like stress, right? And so it's really basically defined as how the body and brain just respond to any demand. And and I'll talk about the graphs in a minute. These are as old as they can be, but they're true of everything when we talk about it, which stress is. So it's always a fundamental part of our life. So you're never going to have a time when we just don't have stress. There is no such thing. And we always tend to view it as bad because it usually puts pressure on us. But what we don't realize is it can help us perform, but also too much of it can help us, underperform. And so, and even being exposed to it chronically can cause other problems. And we've kind of seen this with the pandemic, where it can lead to health problems or immune problems from the stress or chronic fatigue. But then some of that leads into increased, alcohol or substance use, weight gain, other health problems when our immune system gets compromised, like hypertension. So it's one of those things, just like anything else in life, where balance is kind of good. And so if you're looking at the first graph here on the left, it's the Yerk-Dodson law. So, I always kind of think about this more famously because if you think about athletes performing, if somebody goes out, if the football team here goes out and they don't care and they're not feeling anything, their performance isn't going to be very good because they're just not attenuating everything. If they get too stressed and too anxious, well, then it almost becomes paralyzing. So what you see here is there's just this graph where basically saying there's just a right amount of stress that helps you perform at your optimal level, right? So it kind of peaks your interest. So for some folks, a little bit of stress is good. Too much can not be good. And then if you kind of move over to the other one, another famous um, person from psychiatry and behavioral medicine, which is Hans Slay, which he started the model of, the stress theory. And it's been called different things, but he kind of looked at what happens when we get exposed to stress, then after we adapt to it, then how we recover it. So kind of getting back to managing it, it's okay to have some stress. Like it can have some positive things, but we definitely don't want it long term because we can see long term or high levels of long term what it can do to our body, which fits with what happens in its definition of how your brain and your body kind of respond to the demand. So, makes sense so far about your stress question?
Yeah, absolutely. That's a huge help. I really appreciate that.
Yeah, and so if we kind of take stress a little forward, so the American Psychological Association does this piece of stress in America. And what you're going to see over the next few slides is what happened during the pandemic for us. So you can just kind of pick some things. I'm looking at it on my screen, over here, and we look at, um, their changes of weight in men and women, right? So if you look at men, 39% had undesired weight gain. Some 20% had loss. For women, 45%, right? So there's that weight part. And they kind of broke that down with the weight loss piece based on, what generation you're from, your race and ethnicity, essential workers and parents. Like, interestingly enough, if you look at some of the effects that it's had on the parents, it's that very, bottom one there. Um, undesired weight gain is like 51%. So 51% of the people that responded that were
Wow.
parents had, and the average weight gain was 36 pounds.
Wow.
Now, we'll kind of talk a little bit about that. And you'll see it in the next few slides about maybe why that is or why some people aren't as active. But if we kind of move on to the next one, here what we're just looking at is what happened to your health, right? So we had the change of weight. I mentioned before in the previous slide, people start to use substances more as a way to cope, but then also sleeping. So sleep becomes a big one, right? So you, getting back to what this is, if you look at the parents, mothers are more likely than fathers to say their mental health is worsened. So you look at the blue or the purple, however it's showing up for you, the green. So the purple color is the moms, and the green is the dads, and you can see all the different changes. But there are also changes in the same things as a response to that. And it's probably most likely because now you have more demands, right? More of that stress that you're talking about because you have to manage the kids at home, right? Because now everybody's doing school at home. And so now you're doing school and you're doing your job and trying to be on Zoom calls without people just running through and doing all those types of things. It gets to impact you a little bit more. For example, right now, you and I are both at work, but our families aren't moving in and out of the screens and we're not going, stay over there. Hey, be quiet. I'm doing this type of thing.
Well, you'd be surprised. Well, awesome. Let me flip us over to the next slide real quick.
Good. This just kind of talks about the impact that it's had on our essential workers. I think we all know that the essential workers has been a very big talked about area, especially with this going on. It's really no surprise that they've um, said that they basically could have used more emotional support than they received or has received. And then the lower number was, didn't get as much help from the mental health workers they wanted. Um, but then also, if you look at the number that got diagnosed because of that, but if you think about it, it's exposure chronically for a long time. Most of the time, we don't see that. It's been going on now for a little bit over a year. And so I start to think back about times in history where I wasn't, even a part of, and what that kind of did to folks. I mean, the last big thing for me was 9/11, when I was in college. That was a pretty big significant thing that felt like it lasted a long time to me. You could really feel it in our country and how that affected everybody. I'm sure there's other ones. That's just the one that always kind of pops to my mind. Um, but there's other ones. There's no doubt.
Mm.
So moving on from them, you know, they even had difference of race, and here we looked about just a future concern. And if you just look at it, I don't feel comfortable about going back to living life like I used to before the pandemic. And everybody is like 40% or higher, right? So as much as everybody, I mean, I don't know what your experience was, but with friends and people, work colleagues and things, all anybody's ever been doing is talking about, kind of getting back to normal, going back to normal. And we all think we want it, but yet there's a lot of concern about what that looks like. And, um, is it, even if it went back to normal, am I going to adjust? And human beings, the wonderful thing about all of us is, and people forget this, we adjust. We have this wonderful thing, it's human adaptation that comes in that basically says, you know, after a little bit of time, we're going to adjust to something. That's why sometimes when they look at research like on happiness and they ask questions like, hey, if you got a raise or you went on vacation, which one brings you more happiness? And everybody's like, well, it's the raise. Not necessarily the case because you could get your raise and it's great for the first few paychecks, but about middle of the year you start used to making that same amount of money, and the thoughts of, well, they need to pay me more money again start to come back in our head. So it's only kind of a temporary happiness. But if you go and you spend your time uh, with family and loved ones, or friends, kind of creating memories that you always get to pull back on, that has more of a long lasting effect. And plus, you get to practice other things with it, like some gratitude, which can kind of help with stress. But we'll get to that kind of a little bit more at the end. And then the last one, which is kind of interesting, is it changed how we did with our health, right? So nearly half people delayed or canceled their healthcare services. Which you think about it, with telemedicine and then people being at home, you would think it would actually not be that high. I mean, for a perfect example, here at the university, we had telemedicine only for a while, but then I saw people in person over at our local hospital and other clinics, and my clinic schedule didn't change. Um, or I got asked to see more people, but nothing got kind of canceled, which was kind of surprising to see that, just based on the time that we have. And then I noticed after a while, at least I thought, just from looking around, more people out walking around like the river walk and having time to do that, right? Because we're telecommuting and we're doing those things. So when they came out with this, I was really surprised to see that people have been less physically active. But if you compare it to the weight gain that we talked about before, it makes sense. And even physically active enough is just to, maybe your thing was, after I leave work, I stop at the gym on my way home. And now I don't do that because I'm working from home.
Mm. Mm. Absolutely. Well, do have a couple questions for you before we close. Our team here at the University of Alabama has been very excited to sit down and talk with you, so they passed along a few questions for me to give to you. Um, so I'm happy to send them along. The first one being, research has emerged suggesting a new kind of pandemic burnout in workplaces that's driven by a blurring of boundaries that protect work life balance.
Mm-hmm.
What is important for workers to know to avoid these pitfalls?
Sure. So I'm going to kind of add in one of the slides. If you click a couple for me, I'll kind of show you and kind of answer that question. Not that one, but maybe the next one. So this is something I do for the residents. We kind of adapted this sixth dimension of wellness model, and it happens we got 6 points on the A, which works out really nice. But you get to look at yourself from all of these areas, and you kind of rate on how you're doing, right? So right now, if we're looking kind of the occupational piece, right? And what I like to tell people is, and what I've noticed, it's hard to shut down when you're always working at home, and because there's no signals anymore. When you leave work, you literally leave the office and you get in your car and you drive, and then you're home. And so, some of the things that I tell people, because now you can work from home all the time or as much as you want, one of the things I have them focus on is, if you work 8:30 to 5:30 at the university, and if you're at home, and let's just say you're fortunate enough that you actually have a designated room, then when you open at 8:30, you open the door and you walk in and you start your day. And then if you have lunch at 12:30, you'll leave your office, close the door, go have your lunch like you normally would, and you would kind of repeat that process. And at the end of the night, when you go home, you shut the door. You know. Now, if you're somebody that tends to come home and do a little bit of work afterwards, that's okay, but you don't want to do it any more than you used to. And in fact, sometimes with some folks that I've had that's worked really well, some patients of mine is I've actually had them get out and like walk around the block to simulate leaving the house for the day and then coming back so their mind gets in the set of when I can come back, I'm ready to work. And we just kind of mimic the time. If it takes them 10, 15 minutes to drive to work, obviously, if it takes much longer than that, we don't have to go that far. But that's one of the things to do because what's happened is there's no boundary set there. So even if you have a home office, you need to close the door. Like work is over. Right? I'm done for the day. So when you look at that, and that's been really helpful for some folks. At least that's the feedback that they give to me.
Okay. Okay.
Now, maybe the other part, if I'm hearing it and maybe even repeated, it sounded like there was a little bit of fatigue or how to get going type of a thing. Is that correct?
Hmm.
So this is a good one. I put this in here. So if you go to the slide, it's a couple in there that talks about the 5 minute rule, right? So this is a wonderful thing. I've done this in therapy with my patients for years because usually with depression, it's hard to get people going, right? But if we use it in this example, here we are. We got so many things to do. We got phone out, laptop, and all these projects, but we're stuck. We just can't get going. We're just stuck. And we don't know what to do. So one of the things that I always have people do, because it just reminds me of any time you're stuck or I use a car, is once when you push on a car to get it unstuck, you have to put a lot of energy into it. But then once it gets rolling, it turns out pretty well. And so the 5 minute rule basically goes, hey, I have a bunch of tasks. Let's just say I have 5 tasks, but I just can't get any of them going. You just start with one of them and you just work on it for 5 minutes. And at the end of 5 minutes, you can put it down and go on to the next one. Or if you find that momentum, you can kind of keep going. And a lot of times I find it like the car. You know, it's really hard to push, but once it starts rolling, I don't know if you've had to push start your car, but once it
Oh,
rolls,
yeah.
the next job is to run quickly and hop in the seat before the car takes off on you, right?
Hmm.
And that's the 5 minute, and it works very well. Um, Especially if you have a lot of things where you just don't feel like you can get started on something. 5 minute rule works great.
Okay. We're running a little thin on time real quick, but I do have one more question for you, if I can pull it up here. So, there's plenty of research that investing in employee wellness is a good business decision. Do you have any advice for leaders regarding how they can support making this investment in their teams?
Yeah, I think yes. It's a great question. And I think there's a few different ways to kind of do it. One of them, I believe, I just read Amazon's going to be like the first company that's really going to delve into this and have a more encompassing wellness program. I just read an article about that. Um, I think it's like anything else. It's very akin to mental health in the way is start paying attention to it because it's going on in your workplace, and then you start to make it a focus. And if other people see you make it a focus, then good things come from that. It'll take a while to change the culture of business in the workplace, but if you have people that recognize certain things, um, the perfect example. So one of my responsibilities here is I chair the wellness committee for our college, and like committees across our college, we have them like usually once a month. And so I decided, especially over COVID, and everybody's working like, why don't we just have them once every 2 months? Because everybody's having meeting after meeting after meeting after meeting at these times, and it's just a drain. I was like, oh, that's great. Right. So you can do little things like that um, that can really help. Or like I talked about earlier, that culture of shared responsibility. You look at your coworkers and your teammates, and maybe everybody else comes up with a time to do something that's kind of fun or something, together that, that you can do. Even if it's just a little bit of time to kind of get some of that enjoyment and that stress back. And even recognizing that like we're all under stress, so let's be kind to each other. It'll kind of create that, I don't know, more of that workplace where we're a team. I always like that concept, right?
Yeah. So it sounds a lot like being mindful, and dedicating a little time to appreciate little moments that we have together.
Hmm.
Does that make sense?
It does, and I mean, there's so few and far between now. Where before we kind of took them a little bit for granted, right?
Hmm.
Um, but we're also still all working under the stress, so we're all still trying to figure it out. And I think that's another important thing to kind of recognize. And also offering some suggestions if you have a team leader out of a team of five and the other team members say, hey, you know what, this might be kind of good for our morale, then to bring it up in a meeting to discuss it and actually try some different things to see if it helps.
Mm.
I think the other big thing um, that we're trying to do at our college, so if you back up to that Well Bama slide,
Hmm.
um, not,
Yeah,
to,
I'll pull
not
that
to
up real
toot our
quick.
own horn, but um, Carolyn McVicker, who I talk to quite a bit, we have our Well Bama program here, and there's a lot of things there that even sometimes I don't recognize. So I'm always kind of big on educating oneself. The university, at least for us, offers all of these things, and you don't have to do all of them, but there might be some in there that you might find really helpful that you might like to do. So you always want to go to your employer's webpage when they have their whatever their office of wellness or whatever they might term it, and find what's available to you. I mean, this is just some of the things that we have, and obviously it's quite extensive, right? There's classes, there's wellness seminars, there's challenges, there's resources, there's mental health, there's EAP, there's all kinds of things. And I know some people here that um, probably use it more than others, but they've kind of taught themselves how to use it,
Hmm.
and it's just making yourself available to it. So that maybe here's a perfect example. Maybe you guys in your office want to do a move spring challenge with somebody else with the other team in your office, right? Like that's like a wellness activity. A little bit of fun in the workplace gives everybody a chance to manage a little bit of stress, but also kind of come together and work together. That's not about getting a project done at work.
Yeah, I like that. That's really cool.
Mm-hmm.
I know I said that was the last question, but I have one last question before we
Sure.
close for the day.
Yeah.
Because this one kind of speaks close to home with some of the issues that I've had personally. So pushing it forward, what's the appropriate way for someone who is suffering to tell their boss that they're suffering?
Oh wow, it's a great question. I think it's how you would think about how you're suffering and why you're suffering, and also it has to do with the rapport that you have with your boss.
Mm.
I always would say I'm going to use myself because I think that's the best way to do it. Because I've had some stress at times with this, with the pandemic and responsibilities I have, and so I've gone to my boss and said, I'm working on getting that done. I just want to let you know this is what's been going on. So I've been struggling to get everything done at the pace I like to do it. Right. So I don't. I just kind of let them know that if they've noticed a change, so have I, and I'm working on correcting it. And if they have any suggestions, that'd be great. Um, in this instance, my boss we kind of talked about, we both kind of go home sometimes after work and we work, but he does it just like a little bit differently. And
Mm.
so he doesn't feel like he's doing it like all the time.
Mm.
And I think that always kind of helps. But I always kind of tie it to how you're kind of feeling and the action of it instead of just walking by, I'm so overwhelmed, I can't do this, etc. You go in and say, hey, I just not, here's what's kind of changing. I don't know if you've noticed this, but I've been feeling this, and this is where I've been struggling in this area. And hopefully that's the way to kind of have an open door discussion
Mm,
about it, and then you guys can problem solve and work together about it. I'm sure there's some other ways that are a lot better. I'm using myself. It works very well for me because I could just tie it to what I was doing and how I was feeling like I wasn't getting everything done that I used to,
mm,
and how I was kind of feeling about that. But here's why. And the interesting thing sometimes that kind of came up was, and in this case, he's like, I think you're doing just fine. So it's that self perception, right? Because we're still going through, pandemic things like, boredom and stress and other things that can actually change our perception. Um, but I always kind of like those statements, tying it to behaviors and tying it to, how you're making it feel, but also like trying to change it, or I need your help to help me try to change it.
yeah, no, that makes perfect sense. So it sounds like communication and transparency really
Mm-hmm.
are kind of the two pillars to that. Would you agree to that?
I would, and it's sometimes I understand because it almost we hear those words all the time, and
Yeah.
I always wonder if we hear them so much that it makes us eye roll or kind of turn off. Like wellness used to be like that, like
Hmm.
wellness, and now well being, because people just roll their heads when you heard wellness, and now well being kind of pops up. Um, but I think it's yes, those things are communication and they are transparency, but it's the chain of the order of how it's done, right? So that's very important. Like, hey, you sent me this email last week asking about these things, and I had not gotten them done. I wanted you to know why I haven't been getting them done, right? So you're kind of anchoring and chaining everything together. And while it is communication transparency, it's a little bit more than that, because it's a little bit more in depth than it probably would be, especially because if you're talking about something personal, it's about yourself.
Yeah, no, that makes perfect sense. Um, well, thank you so much, John, for agreeing to sit down and talk with us for a little while. I wish I could talk with you a little bit longer. But yeah, well, I appreciate you, and we look forward to speaking more with you again sometime soon in the future.
I'd love to, and thank you for having me. I really enjoyed the conversation for the day. So
Mm.
try some of those tips. 5 minute rule is always good. It's one of my favorites. So, and looking at the six dimensions. So thank you.
Thank you very much.